Welcome to the University of Plymouth. Today we are going to look at doing blood smears within a practical class at the university. You'll see that we are currently within a Category 2 laboratory, which means that you need to be really careful in infection control procedures before and after your practical class itself. You will see that the worktops are all sealed and most benches have taps at the end of each bench set so that you can complete the practical. You will also have Bunsen burners. You will have different disposal units for the type of practical work that you will need to be involved in within that class. You need to make sure the area that you're working in has been cleaned down before you start the practical with 70% ethanol, and again after you finish that practical, clean the components with the 70% ethanol. So for today's practical, we're going to be working with horse blood and human blood to demonstrate how blood smears themselves are conducted. The horse blood itself, you will need to make sure that you have your usual PPE requirements required for a laboratory practical. So your lab coat, your laboratory gloves, and you are going to need, within the COVID pandemic, then a face covering within that area. When you are using your own blood, you only work with your own blood, and as soon as you have retrieved that blood successfully, then you must start to use then the gloves that are required within the laboratory from that particular process. So today we're going to look at the different blood cell types by morphology and have a think about the types of functions that those blood cells do within the human body. So whilst collecting blood from a human source, you're going to use the nice little sterile lancets, which look just like these, all right? And these work, you'll see that the top is in line with the barrel of the lancet itself. You need to turn that perpendicular before you pull out the nozzle, and then you will press that down on your skin to gain a little drop of blood. Okay, before you would use these, you will also use a steri-wipe to clean that area of skin before you do the actual prick itself. So all you need to do is push the lancet now into your finger, and you will see that will draw up a little blob of blood, and I'll demonstrate that in a minute. Once it's formed a droplet on the end of your finger, you can then take it across onto your slides so that you can then perform the blood smear. Remember that working with any type of blood product, that you have to then, once you've got that blood product, you need to use your gloves, and the disposal of any of blood components must go into the sharp spins provided, which are these yellow ones. So any glass or any potentially infectious material will go into a sharp spin. Okay, so we're now going to demonstrate a horse blood smear, and we will then move across then to a human blood smear in a little segment. Okay, so now we're going to do a demonstration of the blood smear using horse blood that we have here. You see I'm using the usual PPE for the laboratory, a nice high coat with the elasticated sleeves, and also our gloves then to protect ourselves and others from cross-infection or contamination. You'll see over here our horse blood is in a little Eppendorf with a capillary tube. If you put your finger at the top of the capillary, you'll be able to draw the blood across onto your slide without any spillage. And if you then release your finger, you'll let a droplet of blood onto your slide so that you can then do the blood smear itself. If you then take your second slide and pull it back on top of your first slide, let the blood move across to the edges of the slide and push forward. you'll see that you'll have a nice smear then with an area of single cells and that nice corona at the top edge, where the microscope will be able to view those cells quite nice and clearly, essentially, so that you can see the morphology of those cells and get the indication of the function of those cells whilst you view them on a microscope.
Go.
Okay, so now we're going to do human blood smear practical. Whenever you're doing this practical in the laboratory, you can only do that with your own blood. And once you've retrieved that blood and then stop the bleeding on your finger, you will then need to put the usual gloves on for the rest of the practical. So what I've got here is a little steri swab, which you just wipe on the top of your finger where you're going to do the blood using the lancet. Take your little lancet, turn the knob perpendicular to the lancet itself and pull it off, and then set that blue area onto the top of your finger and push down. You will then see a little bobble of blood forming, and press it down onto the slide in front of you. And you just need a bit of blue tissue then to stop the bleeding on your finger. With your second slide, bring it back on top of your first slide at a 45-degree angle. Let the blood move across to the end of your second slide and push forward. And you'll see that all you're looking for is a nice single layer of cells, so that your microscope can view that really quite nicely once the blood smear is dried. Okay, so now we're going to start staining our blood smears that we've prepared earlier. You can see on our slides here that you want to have labelled the frosted edge with your name or initials to help you orientate your slide itself. First of all, it lets you know if it's your slide, what that tissue is, and it also lets you know which side of the slide you've actually put your blood smear on to be able to view that correctly on the microscope. We're going to use right stain today, and right stain has fixative already within that. It works by penetrating into the cells and staining the nuclei and granular components of hematological cells. So all we need to do is drop our little slide into the Coplin tube. We're going to do that for 20 seconds, and then we're going to transfer across into a lesser strength, essentially, of the right stain to try and wash some of that stain off. And then we're going to put the slide into buffer, which will then drain off any excess right stain from the cells, so that you can view them much more nicely by microscopy. So if we pull our slide across, again just using forceps, into our next buffer, it will go in there for 5 minutes, and then we'll transfer it into the wash buffer to try and remove the excess stain. Just transfer it over. See,